Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to start talking about sickle cell anemia, which is, I've spoken about that on the show in the past, but I think an update is necessary. Before I continue, I want to again interest you in this book that I just wrote that came out maybe about a month now or so, or 6 weeks. The Best of Clinical Medicine for the 21st Century. It has 110 chapters, 816 pages, and it covers just about all major diseases that have to do with internal medicine and medicine in general throughout the world. So take a look at it. It can be found in your local public libraries as well as wherever you can put your hand on it online, and I always have copies in my office. Sickle cell anemia, very troublesome, common problems that affect mostly people of immediate African ancestry. I use the term immediate assistant ancestry and for a particular reason, because the entire human race are from African ancestry. But those of us who have black skin, I refer to them as people who are immediate African ancestry. That's why I use the term. This is a disease that came to be actually been around for centuries. But in this part of the world, it was clinically discovered in Chicago by a doctor by the name of James Bryan Herrick and his intern Ernest E. Irons. Was discovered first in Chicago in a dental student from Grenada by the name of Walter Clement Noel that was studying dentistry in Chicago. He got sick, and this doctor, as a cardiologist, it turns out, had access to his blood, and then he noticed some bizarre shape of red blood cell, etc., and he went on to diagnose the first clinical case of sickle cell anemia in 1910 in Chicago. But way before that, sickle cell disease had been known in Africa, etc. Now, the incidence in worldwide, they had 300 million folks who have sickle cell trait. However, in this country, there are 3,600,000 people who have sickle cell trait, and about 100,000 folks who have full-blown sickle cell anemia itself. And the incidence is about 8% of black folks and Latino folks in this country have, or throughout Americas, not just in this country, the Americas, 8%. The incidence is the same in black as it is in Latinos, 8%. And as far as at birth, 1 in 625 babies, black babies born, is likely to develop sickle cell anemia. Now, the biology behind that is an incredible story, and that is that Dr. Linus Pauling discovered. He was a biochemist, brilliant person, discovered the abnormality, which was basically in position 6 of the beta globin chain. There's a substitution of valine to glutamic acid. That minor change is what results in the cell being sickling, called sickle cell disease, etc. Now, this particular research, for which he got the Nobel Prize, he had 2 Nobel Prizes. He got one for this work, as well as I got one for the peace issue, because he was very much involved in the peace movement. I think he got a Nobel Prize for that as well. And his work is continuing in California. There's the Linus Pauling Institute that's still doing great basic science work. Now, because of that abnormality that he discovered, the entire field of molecular biology was born because of that. Everything having to do with genetics, pharmacology, and the modern world as we know it started from this research that he did. This was the first of its kind that documented that, and now, of course, you know what's going on all over the world, all the DNA things, all this emanated from this basic research that he did originally, and the rest, as they say, is history. It was taken from there and maximized and multiplies and all sorts of different ways the way we treat certain diseases, certain leukemia, like chronic myelogenous leukemia. We know directly what's causing, we know exactly what medication to target the abnormality, but all this because of this original research that Dr. Paulin carried out. So, where did this gene that causes the abnormality comes from? Well, there are 3 genes that are capable of causing sickle cell anemia. And one gene is called BEN, B-E-N, came from Benin, that part of Africa called Benin, near Nigeria in Central Africa. Then you have CAR, which is for Central African Republic. That's what the CAR stands for. That's the second gene. The third gene is SEN, S-E-N, stands for Senegal, from that part of Africa and Senegal. So you have Benin, Central Africa, and you have Senegal. These are the 3 places that the genes for sickle cell disease come from. Now, depending what part, where in these 3 regions of Africa the slave was taken from, and that's how you wind up with each particular gene that causes the sickle cell disease in the Americas, or for that matter, throughout the world now, because, you know, the world is very mobile now. We can't just talk about, because people are moving around all over the place. So suffice it to say, these are the 3 main genes. Now, I want you to imagine the billions of dollars that have been thrown away uselessly for people whose name and countries whose name I will not mention to disassociate themselves with those 3 genes so as to not associate themselves to the continent of Africa. Now, these are people with dark skin. They look a little different. Their hair is a little straight. And because of that, they don't want to be associated with Africa. Some of them, their skin is much darker than mine. But, you know, psychology, that's what it is. It's a psychological thing. For whatever reason, this country that gave birth to the world, nobody wants anything to do with it because of poverty. Because the people are poor, they don't have all this fancy stuff, and the country is not developed properly. For whatever reason, there's a negative attachment to it, and these people are spending all that money. They have sickle cell disease in their country, but they're spending all that money paying people to do research so as to find another gene that they can say, well, yeah, they have sickle cell disease, but it's not one of those 3 genes, so therefore it's not the same disease. Give me a break. Sickle cell disease is sickle cell disease, regardless what gene causes it. It's sickle cell disease, sickle cell anemia. And as I explained to you, this devastating disease, and I'm going to be here, I'm sure, for several weeks, it's not a couple of months or more, talking to you about sickle cell anemia. So be prepared to learn a lot of stuff. This disease affects every single organ in the human body, period. Doesn't matter. From the brain, to the eyes, to the heart, the lungs, the kidney, the bowel, and the skin. Multiple problems with people have leg ulcers that cannot be healed no matter how many times they try to even do all sorts of surgical procedure, because wherever the blood goes, and the blood of course goes all over the body, if there's a part in the body blood is not going to, that part is dead. So therefore, sickle cell anemia is a classic multi-system disease. and the pain that is associated with it, it is incredible. You have to see big grown men and women lying in a fetal position in the hospital bed, crying in pain because of occlusive disease of the phenomena of the sickling phenomena. You say, well, how so? Well, how so? Because the lack of oxygen, I'm explaining to you where the pain is coming from. The lack of oxygen causes ischemia, local ischemia. And in the process of creating the local ischemia, the tissue involved secrete a substance called kinins. The kinins burn. Let me give you an example of what kinins are like. I'm sure you've had a blister sometime in your lifetime. You get yourself a blister and try to burst that blister immediately. See what happens. It's burned like crazy, but because of the kinin that's inside that fluid in the blister. Okay, so the lack of oxygen causes the ischemia that then causes the release of kinin that causes the pain. And I need you to imagine that these folks start having sickle cell crises, and when I get through talk about the clinical aspect of it, I'll describe to you the different crises. There are multiple different crises, sickle cell crises. I'll go over, I'm just now giving you the pain one, talk a little bit about the pain because that's the most common. But there are many more, and I'll describe them to you. By the way, this sheets in my hand come from this book. Chapter 34 in this book is on sickle cell anemia. And it's a big chapter. See, this is pile of paper. I copied it from the chapter before I came to the studio so that I can go over some of this stuff with you. It's a bad disease. Many states, several states, many states, I know New York is one of them, now makes it mandatory for a Latina female or black female when they're giving birth to test the blood for sickle cell, to test for sickle cell disease, sickle cell trait or whatever. Okay. So, and it is such a bad disease, and there are several types of sickle cell disease. You have SS, you have SC, you have sickle thalassemia, and you have sickle cell trait. So these are the four diseases that are associated with sickle cell anemia. Let me repeat: SS, SC, sickle thalassemia, and SA is the trait. And I just finished telling you worldwide there are 300 million folks who have sickle cell trait. But sickle cell trait is not a bargain either, because it's a complete profile of conditions, medical conditions that are associated with the sickle cell trait. And I listed them for you in this chapter. When I get to talking about the clinical aspect of it, I will explain to you the things that can happen when someone has sickle cell trait. You don't get off scot-free. I forgot to mention the liver. Yes, the liver is also affected by sickle cell disease, the spleen. In fact, people with sickle cell anemia, the SS, has no spleen. The spleen has been destroyed since childhood because of the constant occlusion of the blood flow to the spleen. These individuals are asplenic, which makes them much more likely to develop infection because you need the spleen to secrete certain materials that can attack and dissolve the capsule of some certain bacteria. So when you don't have the spleen, everybody who have no spleen are immunosuppressed, much more prone to infection because of what I just explained. The spleen secrete material that are necessary in order to attack the capsule within which those bacteria found themselves, to destroy them. And when you have no spleen, you cannot do that. effectively. So therefore, these people are prophylaxed with antibiotic. People who have sickle cell disease, we keep them on penicillin if they're not allergic to it continuously. And if they're allergic to it, we give them erythromycin, blah, 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 blah. Okay, I mean, I'm not yet ready to talk about the clinical aspect of it. I'm just giving you the basic, an overview in this segment that you understand what is going on. And the phenomena really is the fact that I want to show you what a sickle cell look like. So I put this, again, this came from this book here. Just look at this half moon. There's an arrow pointing at them. Half moon or banana shaped cell. This is the sickle cell. These are the cells that are sickle. Compared that with a normal red blood cell. This is not normal, but this is a normal size red blood cell. And look at this. And this is not normal because there's a reason for it, which I'll get to when I talk to you later about different types of, because this comes from someone with an SC. Because you have SC, you see target cell, but let me see if I can find a good red cell. Okay. I think that's a good one. See, good. This is not a good one. This is target. This is a good one right here. So these are the abnormalities. This is from SC. You have target cell, you have sickle cell, the half moon shape. That's the sickling. Well, the shape of the cell is one problem because the red blood cell is supposed to squeeze through the tiniest, both the largest and the tiniest little vessel in the body. And when they're going through the tiniest little vessel to deliver blood and oxygen, they squeeze through so that they can pass through. But when the test is sickle, they can't pass through effectively because of the shape of the cell. Also, the cells are very sticky. Yeah, those are very sticky. They're not only mal-shaped, they're also sticky. They get stuck within the vessel. When they get stuck within the vessel, then you have a backflow. Got a problem. It's a mechanical problem. Now, believe it or not, that's part of the problem. Because when the cell, again, this is basic. I'm giving you the basic biology, so you have to bear with me. When the cell is stuck to the wall of the blood vessel, that itself is a major, major problem. Right there, locally, as these cells get stuck to the wall of a blood vessel, it damages the wall of the vessel. That's right, it creates a local inflammatory reaction, making the situation even worse. Because once you have inflammation in the vessel, then you're going to wind up having plaques, development of plaques. That's why people with sickle cell anemia have significant heart problem, cardiac problem. The heart becomes enlarged, they go into heart failure, a whole host of stuff. They accumulate so much iron, the ions accumulate in the wall of the heart, inside the liver, etc. It's a devastating disease. We say, well, how come such a devastating disease? What can people do to prevent themselves from getting it? Well, it's basically genetic counseling. Genetic counseling, people just don't go and have babies without knowing what kind of abnormality the partners are carrying. It will amaze you. The bulk of the folks that I provide Medicare for proudly are black folks. I have Asian, I have Latinos, I have a few Caucasian, but the bulk of them are black folks. It will amaze you that I'm finding 80-year-old folks in my office that I'm seeing for the first time for whatever reason. And I would, because I have my own profile, I have a laboratory sheets that 1.5 length the size of this, that have all my tests that I do. I would do hemoglobin electrophoresis, because that's part of what I do. And I would pick up, you can't make this up, I would pick up sickle cell trait in an 80-year-old individual who already passed it on to generation and generation. They have no clue. He has absolutely no clue that he has sickle cell trait. He's 80 years old, and he's had children and grandchildren. That's part of the problem. people are not paying close attention for whom they're practicing medicine. You cannot, let me repeat that, I know I'm getting some flack, but it's the truth. You cannot practice medicine properly or effectively for individual whose culture that you're not familiar with. And for that matter, you're not sensitive to. That is why now the entire medical education in this country is being reformed. Over the years, 22 years I've been doing this show, I've been preaching about that. Others have preached about it as well. Now the powers to be finally listen. Because the present day medical education was started in the 1900s. Has no relevance to what's going on today. So now finally they realize to reform it. Even the M.A.C.P exam that you have to take to enter medical school has been changed drastically. And now the AMA have given 11 medical schools millions of dollars who are agreeing to reform. And now they don't have any more choice because it's going to happen. It is happening. You can't just treat people how to practice medicine in the book and they have no relationship with the people they're practicing medicine for, because different individuals of different cultural background from different countries are afflicted by different diseases more so than others. And if you're not familiar with those, you use the Caucasian model. There's nothing wrong with the Caucasian model, except that it's just not relevant today. The world is too mobile. What's going on? You pump that Caucasian model into the as a matter of fact, during all this movement that's taken place recently, unknown to you, and the powers to be on the network didn't even publish the hundreds of medical students with the coats demonstrating amount with the black folks and the places where things have been going on lately, say, we don't want this. We do not want you to teach us this way. Black folks matters. They walk around with the bodies. Black people matters, okay? Medical student with the white coats on. You didn't see that on network television. They wouldn't show it to you. And these are, they don't want this anymore. And they have the right. They're paying their money, lots of money to go to medical school. They're entitled to a better education. You can't model the education to satisfy the school so that the students get the higher grade. They have high grade on the board, so therefore the school get a higher grade, higher rating, and the training program has got a higher rating because so many people pass the board. That's what's been going on, my folks. And it has to stop. And they're putting a stop to it. I mean, there's nothing wrong. I mean, listen, I went to a great medical school. I went to Einstein. Einstein now, I just found out, isn't it, among top 10 best medical schools in the country. That's great. I'm proud of that. And I teach at Einstein. I'm a professor. I'm not saying anything bad about any medical school, but it is the reality. You have got to understand it. If you're a surgeon, you could practice medicine on anyone because the organs are just about almost always in the same place. But if you're practicing pediatric, you're practicing general internal medicine, primary care, you're practicing GYN, etc., you can't afford not to know who you're dealing with. Not to discriminate against them, that would be disgusting, but to know, to familiarize yourself with the culture, with the diet, the religious beliefs, etc., because different religion require people to have different diets. And a different diet can cause them to have different medical problems. And furthermore, they come from different countries where they have different diseases, so you have to familiarize yourself with these diseases if you agree to take care of these folks. Otherwise, you're going to miss the diagnosis, causing them to spending thousands of dollars of unnecessary tests when the disease is right there under your nose. You didn't pick it up because you're not familiar with where they come from. When they're telling you this, if they can't understand the language, get somebody to interpret for you so that you understand fully. Because the vast majority of the time, the diagnosis, the patient is telling it to you. The patient is telling it to you. And the history, the patient is giving you, if you know what question to ask. So the key thing is if you have genetic counseling and you have doctors doing proper screening such as a hemoglobin erythropoiesis, you'll be able to pick up a member of the family is carrying the gene. Therefore, that will alert the other members of the family what precaution to take, etc., etc. And it is not just applied to sickle cell disease. It applies to the thalassemias. You go to Greece, see what's going on. They walk from house to house with a little portable blood testing machine to test for beta thalassemia, because the government is paying all this money to take care of these people who are sick with beta thalassemia and all these other problems that they have. Okay, you have got to pay close attention. And I couldn't care less how brilliant you are intellectually. If you don't understand bedside medicine, you're not going to provide proper care for patients. Okay, so in any event, sickle cell anemia is a serious disease, very serious medical problem. And these mal-shaped cells clogged up the blood vessel, and therefore the blood vessel cannot carry oxygen properly, and the person get very sick and needs a lot of pain, requires a lot of pain medication. Again, I'm just giving you the basic in this segment. Next week, I'll begin to get deeper into the clinical aspects of what's going on. Remember, I told you there are several sickle cell crises. I touched a little bit today on the pain crises, and then I have a list of all the crises. I discuss each one of them individually in this chapter. And I'll be going over them with you to explain to you how bad the disease really is, and some of it is totally unnecessary. People have to be more careful about what they do in terms of birthing so that they don't bring misery to these babies. Listen, I'm stopping here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.